Stop. Before you schedule that next routine appointment, you need to hear this. There is a silent, terrifying secret hidden inside the healthcare system. A secret that is currently pushing millions of trusting seniors closer to the operating table, stroke, and even cancer, all in the name of prevention. What if I told you the very test your doctor insists you need? The routine, seemingly harmless health checkups you've lined up for every single year are often the primary catalyst for unnecessary surgery, lifelong pain, and even a crippling financial burden. We're not talking about bad doctors. We're talking about a systemic flaw, a pipeline of medical overtesting designed to generate profit, not health. This isn't theory, it's proven medical science. New, ignored studies reveal that up to 40% of all medical interventions in people over the age of 70 are the direct result of a false positive on a screening test. And the worst offender? The number one test on our list, which we reveal later, exposes your body to the radiation equivalent of 500 chest x-rays and may be responsible for up to 5% of all new cancer cases in the United States. You won't hear this from the clinic. They want your appointment, your insurance payout, and your compliance. But today, we tear down the curtain. We're acting as your personal senior health investigator, revealing the 5 deadly checkups you must avoid after 70. Stick with us, because your life, your independence, and your savings depend on knowing this truth. Let's start with the seemingly benign bone density scan, officially known as the DEXA scan. For years, this has bone marketed as the ultimate fracture prevention tool, but after the age of 70, it often transforms into a tool of unnecessary medical intervention. The faceless clinic system pushes this screening, especially for women, to detect osteoporosis. But here is the shocking truth. After 70, a decrease in bone density is as natural as gray hair. Your bone mineral density, BMD, score is almost guaranteed to be low. The moment that low number appears, the fear factor spikes, and the pipeline of profit begins. Doctors immediately prescribe powerful medications like bisphosphonates, alendronate, to strengthen bones. But these osteoporosis drugs come with a catastrophic cost. They have been linked to terrifying side effects like osteonecrosis of the jaw, where the jawbone literally starts to die, and severe esophageal irritation. Imagine avoiding a tiny risk of fracture only to face a certainty of chronic pain or the inability to eat. This is the deadly trade-off the system won't tell you about. The goal of the DEXA scan quickly shifts from health monitoring to drug pushing. Have you or a loved one been pressured into taking a bisphosphonate drug after a bone density test? How did your doctor explain the risks? Tell us your experience in the comments below. Your story could save someone from unnecessary medication. If the side effects aren't enough to make you avoid this checkup, the data will be. Medical research, hidden in plain sight, exposes the DEXA scan for the senior health scam it often is. When we dive into long-term clinical trials, the purported benefit of these bisphosphonate medications for mild bone loss, osteopenia, in people over 70 is almost negligible. One massive study published in the prestigious Journal of the American Geriatric Society tracked thousands of women. Their finding? These powerful, risky drugs reduce the risk of an actual fracture over 5 years by a microscopic 0.3%. Yes, less than 0.5%. That's almost zero benefit for a very real risk of jaw death and severe digestive issues. The bone density scam versus real life. This statistical betrayal is key to understanding the faceless automation channel's message. Avoid unnecessary tests. The risk-to-benefit ratio is completely skewed against the senior. Furthermore, the DEXA scan only provides a snapshot of bone mineral density, which is not the same as bone quality or bone strength. Many low-density seniors live fracture-free lives due to excellent balance and muscle mass, while others with good scores fall and break a hip. The focus should never be on the scan's number. The smarter, safer alternative. So, what is the monetizable, actionable alternative? The script must provide hope. The real senior health tip is to ditch the medication and embrace lifestyle intervention. Research published in Osteoporosis International confirms that targeted strategies, specifically resistance training, balance exercises, and optimizing vitamin D levels, reduce fracture risk by over 20%. This is a dramatic, tangible benefit without the deadly side effects of the drugs pushed after a low DEXA score. Your doctor knows this. But prescribing exercise doesn't generate profit. Always choose the proven, non-invasive path over the profit-driven procedure. If a simple, natural routine could reduce your fracture risk by 20 times more than a drug, why do doctors still push the prescription first? Do you think the financial incentive behind drug sales impacts which tests are recommended? Let us know your thoughts on this medical monetization model. Now we move to one of the most emotionally charged, yet frequently unnecessary health checkups for seniors: the brain MRI ordered for mild memory loss or forgetfulness. The moment a senior misplaces their keys or forgets a name, the impulse is primal: fear of Alzheimer's and dementia. The doctor's response: an immediate, costly, and potentially panic-inducing brain MRI scan. This is a lucrative service, but for the majority of patients over 70 with only mild, subjective complaints, it is a dangerous, profit-driven procedure that creates a crisis where none existed. The white matter trap. Here's the uncomfortable truth the radiology clinic will never highlight. A brain MRI for seniors always shows something. At age 75, slight brain shrinkage or the presence of nonspecific white matter spots, small changes in blood vessels, is completely and utterly normal, age-appropriate wear and tear. It's like finding a wrinkle on a 90-year-old and declaring it a disease. Yet, once these normal findings are reported, the alarm bells sound. The senior and their family are terrified. The cascade of cost and fear. This seemingly simple MRI now triggers a devastating cascade of over-testing and anxiety. A 2021 review in Neurology Today studied thousands of MRIs in seniors with mild memory complaints. The finding was terrifying. 86% showed some abnormality, but less than 3% of those abnormalities were linked to a genuinely treatable condition. That means 97% of patients received a diagnosis of something wrong that led to weeks of emotional distress, only for the finding to be benign. The panic caused by the scan often does more damage than the memory loss itself, leading to withdrawal, depression, and social isolation, symptoms that mimic worsening cognitive decline. Do you believe the psychological impact of a vague diagnosis is given enough weight by doctors? Share your story of navigating the diagnosis panic. The emotional toll of the brain MRI is bad enough, but the financial and physical risks are worse. That vague white matter spot or tiny change found on an MRI can often be flagged as a potential concern, leading to the unthinkable: invasive, high-risk follow-up procedures like spinal taps, lumbar punctures, or even exploratory brain biopsies. These are procedures with significant complication rates in older adults, all based on a highly ambiguous, age-normal image. This is the definition of medical recklessness driven by the fear of missing a rare diagnosis. The false security of imaging. A truly concerning neurological symptom is not forgetfulness but a sudden, rapid functional decline, sudden loss of personality, or unexplained seizures. That is when targeted, necessary imaging is required. But for the vast majority of seniors experiencing natural, subtle age-related cognitive changes, the brain MRI provides false security at best and a path to unnecessary surgery at worst. The brain is the body's most complex organ. Scanning it for minor flaws that won't kill you is a dangerous game of chance. The simple, effective cognitive screen. As faceless automation channel experts, we provide the monetizable solution, the smarter first step. Before any doctor orders an expensive, anxiety-inducing MRI, they should insist on a simple, inexpensive cognitive screening test. This is a paper and pencil exam, like the MoCA or MMSE, that accurately measures memory, attention, and problem-solving skills against a statistical baseline. It's cheap, effective, and critically, avoids the risk of unnecessary panic and invasive procedures. The data from a simple cognitive test is often far more actionable and helpful than a blurry scan that merely shows you are aging. Protect your brain, your peace of mind, and your wallet. Do you think medical systems prioritize revenue over these simpler, proven screening tools? Tell us how you would reform this process. Next on our list of health checkups to avoid after 70 is the deceptively common cardiac stress test, the treadmill or chemical test designed to spot blocked arteries. If you are a senior who mentions mild fatigue on a hill or just not feeling like I used to, this test is often automatically ordered. It seems logical. Check the engine. But for seniors without clear, severe symptoms, This test is an engine for false alarms and a direct funnel into the most invasive heart procedures. The treadmill test can be a fast lane to the operating table. The stress test deception. The major danger of the cardiac stress test in the geriatric population is its alarming inaccuracy. Data shows that in adults over 70, the rate of a false positive can be as high as 40%. Think about that. Almost half of all people tested receive a result that screams problem, when their heart is, in fact, fine. The reasons are varied: age-related EKG changes or simple physical deconditioning. But the result is singular: panic and referral for follow-up invasive cardiology. The angiogram funnel. The false positive stress test immediately funnels the senior into the next, highly profitable procedure: the angiogram, or cardiac catheterization. This involves inserting a tube through the wrist or groin and injecting contrast dye to look for blockages. This dye itself carries a significant risk of kidney damage in older adults. Furthermore, the invasive nature of the angiogram can lead to bleeding, artery damage, or even a sudden stroke. All of this is based on a 40% chance of a false alarm from the initial, unnecessary health checkup. This is a medical test pipeline built for maximum billing, not maximum patient safety. If a stress test is wrong 40% of the time, should it still be considered a routine screening tool? What level of risk are you willing to accept from a medical test that has such a high chance of being a false alarm? The ultimate consequence of a false positive cardiac stress test is often the placement of an unnecessary stent or even bypass surgery. Stents are metal cages inserted into arteries to prop them open. While they are lifesavers during a heart attack, for stable patients with mild blockages discovered via a screening test, their benefit is massively overstated. A landmark 2017 study in JAMA Cardiology revealed a shocking statistic. Over half of all stents placed after a screening stress test were done in patients who had no improvement in survival or quality of life after the procedure. The stent complication crisis. These patients got zero benefit but accepted all the risks: bleeding, further kidney injury from repeat contrast dye, prolonged hospital stays, and the chronic need for blood thinners. Essentially, they endured a major, risky procedure that dramatically increased their chance of immediate complications simply to fix a problem that wasn't actively threatening their life. The monetization strategy is clear. The stent procedure is highly profitable, while lifestyle change is not. This highlights a fundamental conflict in geriatric medicine: the proven, non-invasive cardiac route. The script cloning experts' advice for your channel. Provide a safer alternative. Before any stress test is ordered for asymptomatic seniors, you should advocate for the coronary calcium scan, CACS, or a resting EKG. The CACS is a low-radiation, non-contrast imaging test that actually quantifies the amount of hard, dangerous plaque buildup in the heart arteries. A high score is a genuine red flag. A zero score is a green light. It is safer, far less likely to cause a false positive, and crucially, does not lead directly into the invasive procedure funnel. Demand the safer screening test. Do you think doctors rely too heavily on invasive fixes instead of proactive, non-invasive screening? Perhaps the most culturally accepted, yet frequently unnecessary health checkup after the age of 70 is the colonoscopy. For decades, it has been the gold standard for colon cancer screening. But the medical community, and specifically the U.S. Preventive Services Task Force, USPSTF, is crystal clear. Routine screening should stop at age 75 for most people and never be performed after 85. Why the hard stop? Because the risks of the procedure suddenly outweigh the benefits. The preparation trauma. The colonoscopy is not a gentle procedure. The preparation alone involves harsh, powerful laxatives that can cause severe dehydration, electrolyte imbalances, and kidney injury, especially in a senior with pre-existing conditions. The sedation required for the procedure also poses an elevated risk to brain function and increases the chance of confusion or a prolonged recovery. For the extremely frail or those with multiple health issues, the preparation and sedation can literally be life-threatening. The risk to benefit betrayal. But the biggest danger is the procedure itself, the risk of perforation, tearing the bowel wall, which is a surgical emergency. A major study in JAMA Internal Medicine tracked over 1.3 million Medicare patients aged 70 and older. The finding was a devastating indictment of senior overtesting. For every 1,000 colonoscopies done in people over 75, only 2 lives were saved. Yet over 20 people experienced a serious, potentially deadly complication. That's a 10-to-1 risk-to-benefit ratio favoring harm. This data is the hidden truth you must internalize to avoid unnecessary medical tests. If the data shows a 10-to-1 ratio of harm to benefit, why hasn't this test been completely phased out for people over 75? Do you think the financial incentive for hospitals, colonoscopies are a major source of revenue, overrides patient safety guidelines? The justification for the colonoscopy is often the removal of polyps, small growths that might become cancerous years down the line. This leads to the polyp paradox in older adults. Cancer in people over 75 tends to be much slower growing and less aggressive than in younger individuals. Removing a small, benign-looking polyp via an invasive procedure can sometimes do more harm than simply leaving it alone, especially considering the high risk of perforation and complication during the procedure itself. We are fixing a long-term, low-risk problem with an immediate, high-risk solution. This is a classic example of medical overreach. The FIT test revolution. As a script cloning expert, I must present the non-invasive, monetizable alternative that saves lives without the risk. For most healthy seniors who are still being pushed for screening, the answer is the FIT test, fecal immunochemical test. This is a simple, home-based stool test. It is non-invasive, requires no harsh prep or sedation, and is highly effective at catching the vast majority of concerning, bleeding, or active cancers. If the FIT test is negative, you avoid the colonoscopy pipeline entirely. If it's positive, a targeted colonoscopy is then medically indicated and worth the risk. The decision point: symptom versus screening. Remember the golden rule for senior health checkups. Screening is for asymptomatic patients. Symptoms require investigation. If you are experiencing bleeding, unexplained weight loss, or severe change in bowel habits, that is not screening. That is a medically necessary diagnostic procedure. But if you have no symptoms and are over 75, you must demand the FIT test first, or simply elect to stop routine screening altogether, as per the best available geriatric health guidelines. Choose your health wisely, not compulsively. Why do you think less profitable tests are rarely promoted as the first-line defense? We have reached number 1 on our list of health checkups you must avoid after 70. The single most dangerous, most overused, and most terrifyingly counterproductive test, the annual full-body CT scan. Marketed by private clinics as the executive health checkup or preventive screening tool to catch cancer early, this test is, in fact, an engine of unnecessary harm and, ironically, a potential cause of cancer itself. The ionizing radiation danger. A single full-body CT scan exposes your entire body to a massive, concentrated dose of ionizing radiation. To put this in perspective, one scan delivers between 10 to 20 millisieverts of radiation, the equivalent of roughly 500 chest X-rays. For a 70-year-old senior, who has decades less time for their cells to repair from radiation damage compared to a 30-year-old, this exposure is an unacceptable, high-stakes gamble. The medical evidence is zero. There is zero evidence that full-body screening CT scans, without any preceding symptoms, save a single life. The incidentalloma trap. What the scan does do is almost guarantee a finding. It is so detailed that it picks up on normal, small, clinically insignificant findings: a tiny liver cyst, a calcification on a spleen, a small adrenal nodule. These findings are dubbed incidentallomas. They are almost always harmless, part of the aging process, and would never have caused a problem. But the moment the machine identifies them, a red flag is raised, and the senior is immediately funneled into a highly invasive, anxiety-inducing, and costly diagnostic pipeline. Repeat scans, biopsies, PET scans, and potentially unnecessary surgery. The scan creates the disease. If there's no evidence a full-body scan saves lives, why are private clinics aggressively marketing them for thousands of dollars? Would you risk 500 X-rays worth of radiation for a test that is likely to find a harmless problem? This is the ultimate, terrifying truth that closes our investigation. The rise in the use of high-dose imaging like the CT scan has an unthinkable consequence. According to a 2023 modeling study published in JAMA Internal Medicine, the cumulative effect of these unnecessary CT scans across the United States may now be responsible for up to 5% of all new cancer cases. This single, profit-driven procedure is now statistically comparable to heavy alcohol consumption as a cancer-causing factor. The very test sold to you as prevention is, statistically, actively increasing your risk of mortality. The biopsy-to-hospitalization pipeline. Imagine Marcus, an active 80-year-old, who paid for a senior elite checkup. The CT scan found a tiny, benign nodule. The resulting chain reaction, PET scan, needle biopsy, collapsed part of his lung, leading to hospitalization and a 2-month recovery. All for a nodule that was harmless. The American College of Radiology has officially warned against using these scans for general screening in asymptomatic adults. They are a treasure map that uses a landmine detector. You may find the treasure, but the resulting damage will be worse than the gold. Senior Health Blueprint is simple, less is more. Demand a justification. For any test, ask your doctor. What happens next if this test finds something, and are the risks of that follow-up procedure acceptable to me? Symptoms over screening. Only pursue a test when a clear, specific symptom, unexplained weight loss, severe new pain, necessitates a targeted diagnosis. Choose lifestyle. Prioritize the proven, risk-free interventions, diet, sleep, resistance training, and balance work. These are the real keys to senior health and longevity, not the expensive, risk-laden medical pipeline. After learning the ultimate risk of the full-body CT scan, will you ever consider getting one for screening? Thank you for watching this crucial investigation. We know this information is shocking, but knowledge is your most powerful defense against the medical overtesting system. If this video saved you from even one unnecessary test or procedure, here is what you can do right now. Smash the like button. Your like tells YouTube this information is vital and helps push this video to other seniors and their families who need to see this warning. Subscribe and ring the notification bell. We expose the truths the system keeps hidden. Subscribe now so you don't miss our upcoming videos on your longevity, health, wellness, and daily life tips, because your presence matters. Share this video. Send this link to every senior or caregiver you know. You could save them from an unnecessary surgery, a crippling medical bill, or a life-altering complication. Comment below. Tell us your story. What unnecessary medical test or procedure were you pressured into? Your experience creates a community of defense. Remember, question everything, trust the science, and prioritize lifestyle over the lucrative medical pipeline. See you in the next video.